the governors talked a lot about the ACA among themselves, okay? And we talked a lot with members of Congress and raised a lot of our issues and concerns. And it was mostly what I would describe as sort of a one-way street type conversation. You know, they basically said to us, what are you worried about? What are your concerns? What do you think? What are the things you think could work better? You know, if you were to make changes, where would you make them? And they took a lot of notes, and the governors gave them a lot of thoughts and a lot of guidance and a lot of advice on both sides. And I think I think that was also sort of the way the conversation with Secretary Price went, which was very much a conversation of, I mean, he'd been on the job for maybe 20 days. He came from the Congress to begin with, but in his new role, he was just recently confirmed. And so most of it was much more of an outreach type thing where people would ask, people on the Hill and Secretary Price would ask us a lot of questions and seek our sort of thoughts and input on that. And I pretty much stuck to the sort of the broad contours and in some cases the specifics of the letter that I wrote to Congressman McCarthy, who asked all the governors for their opinions on this after the election back in November. I do think it's likely. Well, I think we'll probably see something at least get marked up in the House sometime, you know, in the next 60 days or so, maybe sooner than that, based on the number of people who showed up for a lot of these meetings and the kinds of questions they were asking. But in terms of like what the framework might look like at a detailed level, the answer to that is no. I mean, they were much more in information gathering mode than they were in sort of policy dissemination mode.
What would you see changed about the ACA if you could see something happen?
Well, the thing I'm most concerned about in Massachusetts is, you know, when we did healthcare reform in Massachusetts, we basically said, if you have access to coverage to your employer, you can't qualify for Medicaid. And we had an individual mandate. Employers either offered or paid into the uncompensated care pool. And for the first 7 years of health reform in Massachusetts, you know, the relative size of the insured market didn't change much at all. You know, the percent that was Medicare stayed the same, the percent that was Mass Health stayed the same, the percent that was employer-based commercial insurance stayed the same. And then in 2013, we, as a Commonwealth, got rid of the firewall that existed between employer-based insurance and Medicaid. And you can just see, you know, literally that minute, which was July of 2013, now the connector broke too, which didn't help. And I think we're sort of still digging out in a bit from under that. But if you look at it now, it just started this incredible run-up in people who were working, who are now covered by Medicaid, and it's somewhere between 300,000 and 400,000, depending upon how you count it. And it's probably $1 billion of new spending that came as a result of that. And if I were to ask for anything, the thing I would ask is for the ability to put back in place some distinction between working people and non-working people, because, you know, under the federal reform, you do have access to subsidies, and you can structure individual enrollment through the connector to pretty much any plan that's offered by the connector through a business of any size. And the business can contribute on a pre-tax basis to the premiums on that, and so can the individual. But the way we sit now, you know, we've seen 7 points of insured participation in the market move from the commercial world to Medicaid with no increase, for all intents and purposes, in the total percent of people that were covered. It was around 97% in 2013. It's around 97% now. The only difference is we have 300,000 or 400,000 people on the taxpayer's dime that used to be covered through their employer. And that's, there's not enough money in the world to support that if it just keeps happening.